Hello everyone, this is Dan Marsala. This is my therapist-driven vent protocol narrative review oral proposal. So the purpose of this narrative review is to determine if therapist-driven ventilator protocols improve patient outcomes related to VAP, days to wean, and vent days when compared to physician-driven order sets. The aim of this review is to identify and summarize studies that compare patient outcomes that are mechanically ventilated who are managed with therapist-driven protocols to patients who are managed with physician-driven order sets. It is a non-experimental study. It is in a narrative review format, so that means that I will be looking at current literature on the topic to come to answer my study question, which is, do therapist-driven protocols improve patient outcomes when compared to physician-driven order sets? And the statistics are inferential statistics. So the sample selection for this study is going to be include adult patients undergoing mechanical ventilation. So I'll be looking for studies that have been conducted through sources like PubMed, Google Scholar, Albertsons Library, etc. And I will try to I'm going to keep this to just the adult patient population. So this is a summary of variables that are in this narrative review. VAP, vent days, and days to wean are all dependent numerical variables. The plan for this is to conduct an independent t-test between physician-driven and therapist-driven order sets, which are both independent categorical variables, and I will determine from all these studies the mean of these patient outcomes and compare and contrast how they are between physician-driven order sets and therapist-driven order sets to determine if one is actually better than the other for our patients. So the level of measurement for the dependent variables here are continuous interval, and then for the independent variables, the physician-driven order sets and therapist-driven order sets, or therapist-driven protocols are nominal. So 3 lessons so far that I've learned in planning my capstone project. The first one is kind of the most important, is if things feel overwhelming, which I'm not gonna lie, they have, just kind of take a step back, a deep breath, and relax. 99% of the time, it's not as bad as you think. Just kind of have to look things over again, and most of the time, just like, oh, okay, that's really not that bad. And I think the nice thing, it seemed overwhelming to this point, but I think the nice thing thus far is kind of week in and week out, it just kind of rolls into the next week, so you already have a good amount of the groundwork done. The second lesson that I've learned thus far is that Dr. K, Dr. Rice, and Dr. C are all excellent resources, and they've been more than happy to help out, answering questions, whether it's email, having Zoom calls to help with things. If you haven't reached out to them thus far, because you felt nervous asking for their help, don't hesitate to do so. They've been amazing. At least on my end, they've helped me quite a bit, answering questions, like I said, taking time to have Zoom meetings and stuff like that as well. And then the last thing, sometimes complicated isn't a good thing, if you feel like you're getting stuck, try to break it down into simpler terms. When you're doing things like research, you're trying to find information, and sometimes just kind of taking a more simple approach makes things significantly easier for you. So the project timeline. So what I have so far for a timeline is obviously today, the 24th, have the application and the research proposal completed and turned in. By the end of the summer, I would like to have acquired 15 to 20 pertinent articles for the narrative review and have all of them reviewed and, make sure that they meet the criteria of what I'm looking for this project. By the end of the fall 2021 semester, I would like to have my first draft of the review completed and reviewed and edited. And then by the midpoint of the spring semester, I'd really like to have my final draft completed or near completed and ready for review. And then by obviously the end of the capstone course, I would like to have my final draft for the narrative review turned in for grading. So some potential limitations for this narrative review. So far I've found about 8 or so articles that are related to the topic, and the literature thus far has been mostly just retrospective studies, where the data has been post-protocol implementation, and so pretty much what they're doing is they implement the therapist-driven protocol, and then they're comparing like a year worth of data after it's been implemented to like the year prior. So there's some kind of limitations to this because the seriousness of the cases could have been worse for one or the other. Things like that. So it makes it a little harder that they're just comparing all the patients 6 months prior to all the patients 6 months after, without really having any major kind of like anything like any sort of direct comparison, one ICU doing the protocol while one ICU isn't, or, kind of narrowing it down to just specific patient types or anything like that. So that's one limitation that I've seen. And then another one that I've seen actually is there's some studies that have actually come from Europe where protocols, like weaning protocols, have been implemented, but they actually, in Europe, they don't have respiratory therapists. So, in some of these studies that they haven't really found any benefit to having these protocols in place. And it makes you wonder if that is because the lack of having respiratory therapists, where it's just left up to nursing, that they kind of branch out into ventilator management, and they don't really have the focused education, obviously, like we do. So it makes you wonder if that could be part of the reason why there's kind of some discrepancies in their statistics versus the statistics from studies done in the United States and stuff. Well, that's it. I'm looking forward to getting this project done, and I hope that everybody enjoys it. And thank you for your time.